Good morning. Welcome to another episode of Yummy Data Science. And just for some context setting, these are short videos I'm making for a class I teach at University of Massachusetts at Amherst in the Department of Biostatistics and Epidemiology. It's called Public Health Data Science, and I'm making these videos free and available to anybody for curiosity, interest, and learning. So, the module we are currently talking about is a historical perspective on data analysis, visualization, and data science in public health. Um, and the point of this module is that as long as there have been analytically minded people and mathematics and statistics, both disciplines, human disciplines that have existed for a long time, people have tried their best to use analytical methods to improve the health of their fellow human beings. And so, data science, often associated with computers and high tech and fancy technology, has existed for a long time. And the topic of today's discussion is epidemics. And the key person that we are going to be talking about is John Snow, and the disease of interest is cholera. So here's a slide on what is epidemiology, and I want to do some level setting. And it also shows you what John Snow's accomplishment was, because back when he lived and worked, epidemiology was not nearly as fully developed as it is now. So, epidemiology comes from a Greek word. Epi is on, demi is people, and logi is study. So, I'm not sure if that helps, but in any case, you can impress your fellow students by saying that you know a Greek word and it's long and complicated. But it's essentially the basic science of public health, not individual people, but of communities, populations. And the first principles of epidemiology are that it's quantitative. So it leverages math, stats, probability. The second principle is that you want to use a very sound, logical research methodology. So here it's almost like an investigation, like a who done it, and you look for clues. You systematically look for clues, and you create your hypothesis, and you set out to test your hypothesis. So in the case of John Snow, his hypothesis was that cholera was transmitted by water, and he set out to test it, prove it, and as a result, action was taken. Cholera was that outbreak of cholera was stopped. Another essential principle of epidemiology is studying the frequency and pattern of health events in a population. So frequency is studying, how much, how many people per, say, 1,000 people have this disease. How many new people per 1,000 have this disease. So I'm talking about incidence and prevalence. But we'll forget about the terminology. The key thing is to learn the concepts. And when it comes to patterns of health events, we want to be thinking about time, whether the epidemic is annual, seasonal, even daily. What place is it at? Is it urban, rural? Is it at a work site? Is it at school? Is it in a particular geographical location? And then we also want to consider personal characteristics. So is age, sex, socioeconomic factors, um, prior medical history, etc. So we want to study all these, and that very, in a nutshell, is a very brief description of the first principles of epidemiology. So now let's talk about John Snow, um, who is considered the father of field epidemiology. And he was born in 1813. He was one of 9 children. He experienced poverty and unhygienic conditions. And if you look at the dates, 1813 to 1858, he didn't live a very long time. And he dedicated himself to the cause of public health. At the time of his death, he was known as an obstetrician and an anesthesiologist, but now he's really known for his seminal work in field epidemiology and figuring out what was the cause of cholera and how to stop it. This is the famous pump. So he figured out that this pump, water from the pump, was contaminated and was leading to an outbreak and an epidemic of cholera in London. And he persuaded the authorities to remove the handle of the pump, thus leading to a cessation of the epidemic. And so, a little bit about cholera and the London living conditions. This was the age of industrialization, so a lot of people were moving from rural to urban areas. There were lots of people crammed into very tight living spaces. Sanitation, clean water, waste, treatment, sewage, all this was not understood. And so people used to dump their waste, human waste, outside their window. And they used the River Thames as a dumping ground. And so just the air was incredibly stinky. And so the prevailing theory was that there was some kind of like an evil air, foul air, bad air that was causing diseases. And if you think about it, if your whole area where you live stinks to high heaven, then you're going to think that, this is the cause of bad things that are happening in health. But John Snow's hypothesis was that this was not due to miasma, it was due to a bacteria in the water. However, before the age of microscopes, the water from this pump, a Broad Street pump, was very sweet and nice tasting and looked clean. So, well, what is cholera? Cholera is causes acute diarrhea and vomiting, and there's a bacteria in the water that then gets into your intestines, multiplies, and you can die in hours or a few days. So it's very, very quick. There have been 7 major epidemics of cholera, and in the 7th epidemic, beginning in 1961, so far there have been 120,000 deaths. There were several outbreaks in London during the time that John Snow lived. Half of the people who contracted cholera died. And so John Snow was looking for an opportunity to prove that his theory was correct and to stop the outbreak. How did he do this? Very systematically, in a sleuth like manner, he collaborated with local curates and with the local government officials, and he got lots and lots of records. And what he discovered, this is an area in London. And all these black marks, these coffin-like black marks, are the number of deaths. So you can see that this is the pump that I showed you earlier in my presentation, the Broad Street pump. And the outbreak that this picture depicts started when a baby next to the pump died, and its fecal matter was thrown out. And you can see over here, this was a factory, and look how many people died. And then what Jon Snow did was he said, okay, where are all the pumps? So he marked them. And then he said, well, what is the area of this pump? And even though, so the area in red is the walking distance. So even though the pump here is closer, people from these areas, these blocks, were getting their water from the Broad Street pump. Now, in epidemics, what you want to do is you want to look for exceptions and you want to see how they play out. So the theory is, okay, water from the Broad Street pump is causing this problem. So the people who drank the water, are they getting it? And what are the exceptions? So here, everybody was getting water from the pump and they were getting sick. But notice over here, there's a brewery and we don't see any deaths. And so Jon Snow walked over there and he talked to people. And it turns out that these workers were literally saved by, believe it or not, drinking on the job. um, and here there is a workhouse, which is where poor people lived. And so it's crammed full of indigent people with poor health conditions. And very few people died here too. And he went over and talked to them. And this place had its own water supply. Okay. So you can see that the deaths are concentrated around the walking distance, around the ingestion area of the pump here. And he also, because the water was so sweet smelling and nice tasting, he also talked to several people, and there was an aunt and a niece 2 miles away from the pump, and their family used to bring them water from the pump. And tragically, both the aunt and the niece died. So he was a sleuth, he was an investigator, and he was trying to figure this out. So, exceptions, people who did not drink the water did not get sick and die. People who drank the water but lived outside, if they drank this water, they contracted the disease. So, it was a wonderful example of field epidemiology in practice. And so Jon Snow talked to the authorities and he got the pump handle lifted off the pump and the epidemic ceased. So big win. Now, I wish I could say to you that we don't have this problem anymore. And yes, what Jon Snow did was amazing. You can see here, typhoid is another waterborne disease, and as soon as chlorination in the water started, this is a graph of death rates for typhoid fever in the United States. And around 1908, the chlorination started, and you can just see the death rate plummet. Okay. So that's a good thing. But unfortunately, we cannot be complacent about the need for clean water. And a lot of recent instances like Haiti and Flint, Michigan have shown us that we've got to provide clean water. There's another diarrhea and vomiting condition that mostly affects children under 5. And this annually kills about 500 children under 5 years. And the most of the burden is in low income countries. Rotavirus. It has a vaccine, although the vaccine, the rates of vaccination are quite low. So the point is, he's the father of field epidemiology. Look at the amazing work he did, and let's continue forward in his footsteps. Needless to say, This video had a lot of sources, which I will be putting in as links. These are some YouTube videos. Chapter 5 of Case Studies in Public Health, a fascinating read, explains more about John Snow. And then here I found out a very easily readable textbook, and you can read parts of it. It's Principles of Epidemiology in Public Health Practice from the CDC. So thank you for listening. Happy learning.